Welcome to another episode of Easy Access to Healthcare for All, a program which brings you news and issues around the National Health Insurance Scheme as it drives Nigeria towards universal health coverage. A strong workforce is the backbone of every organization. With that in mind, the leadership of the NHIS is making sure it revitalizes the scheme towards fulfilling its mandate to Nigerians. Capacity building for members of management is targeted to help them drive the scheme forward. In view of that, a capacity building training tagged NHIS Leadership Training Development recently held in Lagos for management staff. The training is geared towards repositioning the scheme towards the attainment of universal health coverage and creating a better NHIS in general. This training is the first of its kind, and our program brings you highlights from the event as well as management reaction to it. I am your regular anchor, Aisha Muhammad Ahmed. Please stay tuned. I will be back shortly with details of this event and more.
Easy access to quality healthcare for all. NHIS.
First on the program is a highlight of events around the NHIS. In the news, NHIS meet with development partners in Abuja. New trends in the scheme, top agenda.
This is something that always don't develop them fast.
The National Health Insurance Scheme held a meeting with its development partners in Abuja on Tuesday, the 19th of April 2022. The meeting was to enlighten partners on the new trends in the scheme, to strategize ways forward, and to discuss what is expected from them as partners. The event kicked off with a presentation by the Executive Secretary, Professor Nasir Sambo, who gave a rundown on how far the scheme has come, its activities and reforms.
We all know the importance, the desire to reform the system, the desire to revitalize the health system in a collapsing system, the various tools that are used in strengthening the health system, and the various tools that are used in reforming the health system. But there is a sense of urgency. 2023 is next year, and 2030 is less than 8 years. Just last 2 years, we were talking about the fact that we have 10 years to attain universal health coverage. Now, 2 years have gone down the line. We have remaining only 8 years. And we need to really move fast if Nigeria is to be recorded among the countries that will attain the universal health coverage. Certain changes in policies, including laws and institutional arrangements, are necessary to achieve health security deliverables and sustainable development goals. So this meeting is very, very important because we don't have time. Before you know it, another next 2 years. Before you know it, another next 2 years. Before you know it, 2030 is around the corner. So how do we come together quickly and see what support can we give? How do we work? How do we synergize and be able to attain the universal health coverage?
After his presentation, there was room for observations, contributions, and proffering of strategies that will take the scheme forward. Speaking after the event, some partners harped on the importance of such meetings and their perspectives on the reforms going on in this scheme.
Is to bring together different developmental partners that are already supporting government or supporting the NHIS to achieve universal health coverage. And, we as Farm Access Foundation have been supporting the NHIS for many years in trying to achieve universal health coverage. So it's really heartwarming to see so many different partners, some of who I've never met before, but all of us are working together supporting the NHIS. So this is a huge opportunity for us to come together, understand the strategic plan of NHIS itself, and to see where we fit into that strategic plan in terms of our technical support towards this overall objective.
It's quite interesting that from what we have seen today, it seems that the NHIS is trying to put a framework for delivering on its mandate on making sure that Nigerians are able to access healthcare using the instrumentality of health insurance. And so I think from the presentation today, it lays a good foundation for for her partners and the people the NHIS work with to kind of key into areas that they can help strengthen, as well as areas that partnership can be forged for the NHIS to meet its mandate.
Welcome back. In our next segment, Issues around the NHIS, we shall see what the scheme is doing to build capacity of members of management through the recently held training in Lagos. Highlights of the topics and sessions, as well as expectations from the tutors during the 3-day event, make up our Issues around the NHIS. Please stay tuned.
Easy access to quality healthcare for all. NHIS.
A capacity training program was organized for top management staff of the National Health Insurance Scheme, which include the general managers and zonal coordinators. The event, tagged NHIS Leadership Development Program (NLDP), held at the Enterprise Development Center of the Lagos Business School, Lagos. Result for Development, an international organization, facilitated the training. The event started with a welcome address by Professor Nasir Sambo. He urged participants to embrace the training program and maximize the opportunities therein.
I want to encourage all the participants here to dedicate and commit themselves for these 3 days, because this learning of today will be the beginning of the learning and leadership management within the national health insurance ecosystem, not NHIS alone. And we appreciate the role of my friend Dr. Hope for making this program reality. And we do hope that the organizers will prove to us that they are in business of leadership and management training. Thank you very much.
Professor Sambo, who described the program as a work in progress, noted that for it to succeed, a slogan has been developed for it.
This NLDP program in the NHIS is a work in progress. And for it to be succeed, we have already developed a slogan so as to guide us in whatever we do. And the slogan is building capacity for universal health coverage. If we say NLDP, building capacity for universal health coverage.
Dr. Hope Uweja, Country Director of Result for Development, R4D, in his opening remarks, said the NLDP was conceived based on the need to build the capacity of the senior and management staff of NHIS as a result of the ongoing transformation in the organization.
The NLDP was conceived because it was realized that for an organization that is undergoing transformation and whose role was changing, there was a need to build the capacity of the middle and senior management staff. And we are gracious to the Bill Amenida Gates Foundation for being not only the donor, but for working with us, both the R4D and NHIS, to design this program.
The event was packed with several training classes, interactive and breakout sessions.
After I was appointed,
the Medical Director, CEO of the Federal Medical Center, Ibutemeta, Dr. Adedamola Dada, took one of the topics, Leading for Change, as he spoke extensively on different aspects, such as change management and how he midwifed the success story of his hospital.
you must ensure that I love your plan, I said so, but you must ensure that you manage this change effectively. So, the management, we are going to change. The management of that change is absolutely very important because you are dealing with human beings. In every system where there's going to be change, okay, some people will lose advantages, some people will gain advantage. So one, problem identification so that you can find the solution. Okay, you need to prepare the organization for change. And what did I do? All right, every department, based on our strategic plan, which I will show you now, that I wanted to effect change, I first called the officer, and I will use the issue of I wanted to do our ideology. Okay. We computed what we needed to effect change in our ideology.
At the end of the day,
This class on leading for change was followed by another on critical thinking and team activity taken by the Deputy Director of EDC, Mrs. Ineka Okekiaru. Some of the other topics treated include the concept of a team, the team building process, characteristics of effective teams, and stages of team building, among others. 9 basic steps of consulting EDC experience: performance management for corporate excellence, leadership and leadership style, coaching and mentorship for institutions, change management and emotional intelligence, and several other topics treated in breakout sessions. Some of the lecturers at the training speak further on their topics of discourse and what they expect the participants to take away from the training.
Basically, it was an exchange of ideas session, not so much of teaching. Don't forget that we are in the same ecosystem. We all are from the Federal Ministry of Health, so it gave me an opportunity to be able to share my experience, how we were able to, do a few things at the Federal Medical Center that transformed the kind of services, our ability to actually serve Nigerians better. And it was an opportunity to discuss this change management and the process of change management with the top management team of the NHIS. So it was more of exchange of ideas. I gave them my own ideas and my own opinions and the strategies that we used. And I was able to get a few feedbacks from them.
So from the training itself, I expect them to, by the time it's done, to understand the importance of skill transfer and not to be scared of the consequences of skill transfer. In fact, to understand that there are more positives than negatives. And that from my presentation, I want them to be able to understand the importance of mentorship, why they should be mentoring people, how to mentor people, and most importantly, how to get their mentees on board with the mentorship program.
It's about looking at the various ways that we can manage performance within the organization and also how to tie individual performance into the corporate goal. The second presentation was on change management. So we looked basically around what change is, how change can come, sources of change, the types of change that can come, and then how to manage the change process. So we looked at a documented way of managing change in order to ensure that people within the organization are all carried along whenever change happens.
First of all, the team from NHIS, they have a lot of knowledge that is very residual, but they can also upscale some of those competencies. And the module that I took them is to be able to help them to understand that for them to be consultants, whether as soon as they leave, the process of being a consultant with sustainable practice. That's what we talked about. So how do they harness the competencies they have? How do they bring in those other competencies to help them where they have shortfalls or weaknesses? The process of understanding what the market requires and how they position themselves to be able to offer those kind of services, up until even how they price themselves. These are things that you don't do when you're in the public service. But when you're a consultant, there's a process in which you can go through all of this.
One thing that is important for any organization to thrive and grow is training, retraining, and capacity building. And this is exactly the path that the current leadership of NHIS is treading. In summary, the Executive Secretary of NHIS, Professor Nasir Sambo, speaks on how the leadership training will impact on the attainment of the universal health coverage by NHIS.
The scope will not only be limited to the National Health Insurance Scheme, but the entire social health insurance ecosystem. That is to say, it will include even the state health insurance agencies. Most of the states have created the agencies, but the skill in leadership in health insurance is not there. And for us to be able to perform our coordination role, we need to factor them in the capacity building we are doing. Apart from that, we are also looking at NHIS being a leader in attainment of universal health coverage. And if you look at the element of universal health coverage, there is demand and supply side, there is population coverage, there is what is called service coverage, there is what is called financial risk protection. And if you look at the box that encapsulated the element, the financial risk protection is on top. So that gives NHIS opportunity to be the lead in the process of universal health coverage. So this leadership training that we are doing, we are not even doing it restrictively to address health insurance issue, but also to address the issue that has to do with supply side. So that's why we are looking at this leadership training as the entry point of aggressive capacity building for attainment of universal health coverage in Nigeria.
Welcome back. In our stakeholders segment, we bring excerpts from interviews with participants at the NHIS Leadership Development Program held for members of management. When the program started, we spoke to some of the participants on their thoughts and expectations from the training.
There's a lot of expectation, and the most important thing, just because we are here for a leadership training, is to be able to chart a new course in terms of leadership within the scheme, and also to be able to mentor those that are coming up behind us. Leadership, like we all know, has so many dimensions to it, and there's not one style that you can say is the right style for people. So what I want to learn here at the end of the day is to be able to know the different types of leadership styles, and then to know which to apply at the right time for everything that happens within the scheme. Our main goal is to achieve universal health coverage, and we need to be focused as leaders to be able to get to that destination.
This is a leadership training, so my expectation at the end of the day will be like looking forward to making adjustments in my leadership style. We have teaming staff in the Zoom, the whole Zoom, about 114 staff in different offices. So as a leader, one must be able to contain, one must be able to direct, one must be able to lead, to mentor appropriately, positively, so that at least they being at the states being at the implementation level of the scheme would be able to conduct themselves and operate positively to the benefit of the scheme.
It has to do with training and leadership. I want to be a better leader to help NHIS in the pursuit of its mandate of ensuring that we provide coverage for all Nigerians. One, that's the primary thing, because I know that leadership is very important, more so as the scheme is moving to reposition itself to become a more credible organization than it used to be. We need that leadership to guide the chief executive in attending the new vision. Two, we equally want to learn how to better improve my staff in terms of mentorship, how to mentor them to become better staff, to have new values within the system as we move towards attaining our objectives.
My expectation as a head of department of enforcement is to see that one, all the other management experience that I had, and also with the practical leadership role that I am having, that I'm leading a department. One is that I sustain all those experiences. Two, the new thing that I'm going to get, I'm going to gather the new experience I will get from this particular participation in this particular program. I will use it now to develop my department so as to be able to fit into a very formidable team within the NHIS, so that we'll be able to deliver the mandate of the scheme.
One of the things that I had clearly stated was that I'd like to have a consolidation of my experiences garnered over the years. And I think within that space, I'm happy to say that a lot of those expectations are being met. And I'm sure by the end of tomorrow, I'll be able to clearly say that my expectations on this training have been met.
When the program ended, we also sought to know what they are taking away in terms of knowledge from the 3-day training. This is what they had to say.
The most important is that I realized that the progression of an organization depends largely on the character of its leadership. And that the responsibility of the leadership is enormous. You have a responsibility to bring up others, coach or mentor them for progression of your organization, replication of the culture your organization have come to be known for. You have a responsibility to identify changes in your environment and plan for it and monitor that, or else you may be left far behind compared to your competitors.
Quite a number of us in the management team at this point in the history of the agency are in transition. In other words, to an extent or the other, we are transiting out of the system. But this training has given the exposure that we require to be able to develop a succession plan that allows us to groom people who will own the roles that we play today, so that even in the event of our departure, there is no gap such as is deep enough to be able to cause, an interruption in the flow of activities and the performance of roles in the system. So it's been highly rewarding and very, very remarkable.
We've learned really a lot. Some things we have been implementing without knowing exactly what we're doing, and some things that we find that we really have to improve upon. One thing that we've really taken home is that there's really need for us to have a succession plan. And the succession plan does not rest on us alone. We also have to do some mentoring, As you do succession plan, it involves mentoring, and you have to also know how to manage, change. Because as you do things along, it's a team building thing. So it does not rest with you. You're dealing with people, so you have to know how to manage them.
We will now take your questions in this last segment of the program.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
Question: if I am single, can my children benefit from my contributions?
Definitely. Your children, once they are biological, it doesn't matter. We don't decide whether you are married or single. The basis is that you are actually a contributor under the health insurance system, and we can verify that the children that you are registering are your biological children, or whether biological or adopted, as long as we have proof that they are your children.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
I think I paid almost nothing.
It went easy. We only paid 10%.
We all work towards accelerating universal health coverage.
Everybody, irrespective of his gender, has access to basic healthcare services.
NHIS.
And so we draw the curtains on this week's episode of the program. NHIS is leaving no stone unturned to see that it fulfills its mandate to Nigerians. Join us every week as we continue to bring you updates on more of its activities and strategies as it marches towards universal health coverage. See you next week.
Easy